You know, 3.5 million New Yorkers, they're fully vaccinated based on the latest figures from the City Health Department.
Indeed, and that is a little over 43% of the population. Let's get a closer look at the numbers, though. It shows that the Bronx, Brooklyn, and Staten Island have the highest rates of unvaccinated residents.
Yeah, City Councilman Mark Levine has a drastic proposal to reach those unvaccinated New Yorkers, and it's to close mass vaccination sites, try a more community-based approach. The council member now joining us this morning to share his plan. So good morning to you, sir. How you doing?
Good morning.
Morning, Betty and Dan. Great to see you.
So, Councilman, let's get into this, right? Because it sounds very interesting. Queens, Manhattan, they have the highest vaccination rates, 47%, 55% respectively, right? So you represent Harlem and Washington Heights, where there's a big push now to make vaccinations available to communities of color. We've been talking about this from the beginning. So why do you think that closing mass vaccination sites will help reach those communities?
Well, we have made enormous progress in vaccination, but the citywide average doesn't tell the full story. There are some communities where only 25 or 30% of folks have been fully vaccinated. And that leaves us really exposed as a city. We're gonna have to change our strategy to close that equity gap. And you know, these mass vaccination sites served us so well in the early days of vaccination when we needed a place to receive thousands of people who were excited to get a shot. But the flow there has reduced dramatically. The flow of vaccination citywide is way down. And we're gonna have to take the vaccination to people, to neighborhoods, which are getting left behind.
You know,
we need to have people out on, please, yes.
Yeah, I'm sorry. I was going to say yesterday you tweeted out that 53% of adults are fully vaccinated, but the city's numbers, which were updated yesterday morning, show only 43% of New Yorkers are fully vaccinated. What's the difference in the discrepancy there? Why is that?
I think that would be whether they have one or two shots. So
Okay.
I think 53% have had at least one shot. And so we're confident that they're going to get their second shot. But that leaves almost half the city which hasn't gotten even its first shot.
Now, do you think that those people who have not gotten the shot, right, specifically in communities of color, you're saying bring the vaccines to them, right?
Exactly.
So you broke down the vaccination rates by zip code, which show that there is a racial disparity, right? Because look at the zip codes right there.
Yeah.
Now, by bringing it to the neighborhood, do you really think that they will go and get the vaccine rather than go to a mass vaccination site? Is that the problem that you're hearing?
For many people, yes. Look, there's some New Yorkers who are anti-vaxxers and they just don't want it. But there are a lot of people who are open to getting the vaccine, but they just haven't gotten around to it. They have busy lives because of work and family, and they're not going to be able to travel 30 minutes or an hour to a mass vaccination site. But if vaccination is available in their church, in their community center, in their home through door-to-door vaccination, then they'll get it, and they are getting it because we have those efforts underway to a limited extent, and they get great results. But that requires staff, and we have hundreds of staff at every single one of the mass vaccination sites, nurses and other professionals, and they could be redeployed to where they could reach people where they live, where they work, where they worship, where they study. And that, I'm sure, would boost our vaccination rates where we need it most.
Let me ask you, how much would it cost to bring community-based vaccination sites to those 27 zip codes, which you say the vaccination rates are 40% or lower? And then who pays for that?
We're already paying for the staffing at the mass vaccination sites. I'm talking about redeploying resources. And much of it is reimbursed by FEMA and other federal sources. At any rate, spending money on this problem is the least of our challenges. We want to avoid another wave in the fall. And that risk exists at a time when variants have taken over. Now, if you've been vaccinated, you can do almost anything safe. The vaccines remain incredibly effective against all the variants. But for the almost half of the city that hasn't been vaccinated, there's still real risk. And we don't want to have another wave because we just didn't act quickly enough at this critical moment.
So time is ticking, right? You have a very good point, and we're trying to get to that herd immunity status of 70%, and we want to do that very quickly. So what would it take to get these sites up and running quickly in these neighborhoods?
Yes, Britain, by the way, which has a similar vaccination rate, is undergoing a new wave again because of variants. Now, there's differences here. And I don't think we are as at risk, but let's not be naive. This pandemic has not finished for people who are not vaccinated. But if we take vaccination to people, we're going to increase the vaccination rate where we need it. But we have to change up our strategy and put all our resources on the ground, on street corners in Uptown Manhattan, in the South Bronx, in Central Brooklyn. We've got to be opening mass vaccination centers in NYC community centers. We have to be going door to door with vaccination for people who can't get out. This strategy has worked. We just have to ramp it up now.
Timeline. How quickly can you do that?
We can do it immediately because the staff is already in place. We're talking about redeploying staff, which is now sitting at mass vac centers where the traffic is down dramatically. This could be done very quickly, and we must act now.
All right, Councilman Mark Levine, thank you for joining us and explaining this
Thank you both.
new way forward. We appreciate it.
Thank you very much.
All right.